The fight is against an invisible enemy. Frontline workers are leaving nothing to chance. The COVID-19 pandemic has no holy cows. The disease has claimed the lives of 44 healthcare workers in the Free State. More than 3,700 health professionals have been infected. To some, this has been a psychologically draining exercise.
The deaths when coming to COVID, they are more than under normal circumstances. And it's something that's really even tearing us apart, because we also put ourselves in those families.
Basically, being a doctor during a pandemic obviously is very stressful. Basically because we don't really know much about the COVID-19. So we know corona, but we don't know much about COVID-19.
Despite the challenges, healthcare workers continue to risk life and limb. Those who work in the intensive care unit share their experiences.
It's a very stressful situation because the high care has a lot more critical patients requiring higher levels of care. We are a specialized oxygenation unit. So when someone has lung damage from the coronavirus, they don't get the oxygen through their lungs into their body.
Initially, it was quite challenging with the amount of ventilators that we had, but we had to set up a criteria for patients, and we had to, come to a point where we ethically choose the patients that we thought would survive adequately once intubated. Because
over 61,000 COVID-19 cases have been recorded in the Free State, with more than 2,000 fatalities. The surge of infections is a concern for health authorities.
We really appreciate the work they did, because I think as Free State we did very well in fighting this pandemic. When it started, people thought we would be one of those provinces with high numbers.
These frontline workers, including the health MEC, are all COVID-19 survivors. The journey has not been easy and the fight continues. Aphumelele Mdlalane, SABC News, Bloemfontein.